summertime.
Hey mamas, it's Get Nurse Tiffany, and I'm about to tell you the top 4 things that you can maybe expect at your first prenatal visit. So you've just found out you're pregnant, you've taken the test, you've made the call, and you're headed in for your first prenatal visit. These are the top 4 things that you might encounter at your first visit. Number 1 would be going over when the date of your last menstrual period is. Number 2 would be going over lab work that may need to be drawn at that first visit. Number 3 would be getting a ultrasound scheduled. And number 4, if you haven't had a pap smear in the last 3 years, that would be your number 4. You'd be getting a pap smear done at that first prenatal visit. And when you're thinking about getting pregnant, what things that you can talk with your doctor about, kind of like a pre-pregnancy visit. I also have went over kind of calculating that possible due date even before you have that first visit. So keeping that in mind, that would be like the date of your last menstrual period minus 3 months plus 1 year plus 7 days to kind of get that approximate month of birth. So going over that, and then also at your first prenatal visit, the doctor will want to know that information, the date of your last menstrual period. They'll also want to go over with you some possible lab work that you may need to get done. For some patients, they like to go ahead and just get some general labs drawn to kind of have a baseline for them. Other things that they may do is if you haven't had a pap smear in 3 years, they will go ahead and offer that to you. Again, that's going to be that speculum exam, get the pap smear, and then at the same time, they may ask if you want STD testing, which would include gonorrhea and chlamydia testing as well. They can get all of that done quickly and during that exam. And then one of the last things that they'll want to go over with you at this very first visit is making sure that you schedule your first ultrasound. Depending on how many weeks you are at this point, will kind of determine how soon they'll want that ultrasound done. Now keeping in mind, this is just your first prenatal visit, so they may not go over a ton of information with you just because it is the first visit, but if you have questions, concerns, make sure to bring in like a medication list, things that you're taking regularly if you have questions about, and then also just anything concerning. If you're wondering about exercise, nutrition, anything that they can help with. If you're dealing with nausea or vomiting, this is a great visit to kind of go over that and kind of get that all out on the mind. So when you get in line to get ready to schedule your next prenatal visit, keep this in mind. So when you are anywhere from your first prenatal visit to about 28 weeks, you can expect to schedule your appointments out about every 4 weeks. Now, once you've transitioned from 28 weeks to about 36 weeks or so, you're gonna move to every 2 weeks when you start scheduling appointments. But once you get to 36 weeks to delivery day, expect that you're gonna be going to the doctor every week. Now, this does not include high-risk pregnancies. This information is solely for those that are not considered high-risk pregnancies. For those that are, they're gonna want you to be seen a lot more often. So this is just kind of a template for you. So when you go to schedule your appointments, kind of be expecting how often you should be scheduling your appointments. And don't be alarmed when you get close to delivery day that you go to the doctor every week. They just want to make sure everything is fine with you and baby. And if not, then they can send you over to labor and delivery to be checked out as well. That's why they make it so often towards the end of your pregnancy. All right, guys, that's my tip or video for the day. I hope you enjoyed. If you did, please hit that like and subscribe button below. Thanks, guys. I'll see you next time.